Hi, welcome to Baby Talk. Hi. And for those of you who are already here, hi, welcome. Thank you for being here. And for those of you who are now only joining, welcome. Thank you so much for being here. Hi, I'm Cindy, and you are with us live on Baby Talk Live, and we are Baby Talk right here. Okay, Baby Talk Magazine, as you would have already known, we are one of the top parenting, pregnancy, and baby magazines in Malaysia. Thank you so much for being with us today. And today's session is brought to you by 𝗏𝘃𝘃. Okay, so 𝗏𝘃𝘃 is the provider of specialized eye screening for babies and newborns. I know probably some of you may be wondering, do newborns even need eye screening? I mean, they're so small and all that. Huh? So yes, they do. You'll be very surprised to find that they do. And we're about to tell you why soon enough. Okay. So in just a while, we'll be having our very special guest with us. And he is a pediatric ophthalmologist. I hope I'm getting his occupation right here. Okay. So he'll be here to talk to you about newborn vision development. Okay. And the focus today will be about newborn eye screening. Okay. So don't go away. Don't go away. Stay right here because we also have loads of giveaway just for you. I'm not going to show you yet what is it about. Okay. So it's a very special giveaway. And actually, you know what? I'm just going to have you like a peek at it. Okay. Just let you have a peek at this. Okay. So this is what we're giving away today. And we have a limited amount of this. So I hope you guys will be with us to the end. Okay, because we really, really, really want to give this away to you. Okay. So before I go on, I would like to ask a favor to all of you. Okay. Hi guys. Hi Atira William, Yin, Adeline. Thank you so much for being here. Damien, thank you so much for being here. Mi, thank you so much. Okay. Would you guys do me a favor and please like and share this this Facebook Live? Okay. So okay, the next I'd like you to do is in a while I'll share with you how you're going to win this year. Okay. So all you gotta do is like the 𝗏𝘃𝘃 Facebook page, tag your friends in the comment below, and be an active participant in our Facebook Live. Okay, that's how you're going to win this. Okay, so all right, okay, so I'd like to talk a little bit about what we're doing here today. So these days I'm sure you notice that there are a lot of children, young children, some as young as toddlers, and they're going around wearing spectacles just like this, right? And due to eyesight problems, right? So sometimes they may even be babies who are born with eyesight problems, right? So in most of these cases, the parents even find out quite late why that their babies actually have this eyesight problems. So if you're a parent or parent to be and you actually want to detect these issues in your babies early, so what you should do is you're at the right place, actually, right place and the right time, because we have with us today the exact person who's going to talk to you about this, okay, about vision development for newborns. Okay, so don't go anywhere, and don't forget, I'm being asked to smile. I'm so sorry. Okay, so don't forget to tag your friends, and share this wide and far so everybody knows what we are doing here today. Okay, so yeah. Like I said before, so if you're a parent or a parent to be, okay, you definitely want to know more about if there is a way that you can detect eye issue in your baby. Okay, so in a while we'll be having our guest speaker coming up with us. Okay, and actually I think he's about ready to join us. So I just want to remind you, this is what we're giving away today. Okay, this is what we're giving away today. Infant vision stimulation flashcards. We have a limited amount of this. So what you gotta do is you gotta go to the 𝗏𝘃𝘃 Facebook page and you just follow them. All right. So next, what you gotta do is you come back here. Don't go running away because that's not how we give away these things. Okay. So please come back here and tag 3 friends in the comment page, in the comment your comment space there. Okay, thank you so much. And then next, what you're gonna do is be an active participant, because we really want to give you this. We really want to give you this. So tagging and liking, that's the easy peasy part, right? Everybody can do that. You guys have been here, you know the drill. So how you're going to win this is actually be an active participant in here. That means you see the little comment space there. Yes, please go on and spam it. You want to put 100 loves there. You want to put all the thumbs up. You want to ask our doctor lots and lots of questions. Please do so. Okay. So that's how. And please share it to all to your friends and to your groups and everywhere. Okay. Thank you so much for being with us. Hi Yin Yin. Thank you so much for being here. So right now I'm going to introduce our doctor. Okay, I'm going to tell you a little bit about him. Dr. Sunder Ramasamy is a pediatric ophthalmologist. I'm really hoping I'm pronouncing it right. I don't want to read interpretation here. So he is trained in HKL in Hospital Kuala Lumpur and also in the Singapore National Eye Center. Okay, and he is a part-time lecturer, and he's a member of the Malaysian Medical Society as well as the Malaysian Society for Ophthalmology. Okay, so in the recent years, Dr. Sunder Ramasamy has been working with 𝗏𝘃𝘃. Okay, and 𝗏𝘃𝘃 is the provider of something called UNEED, UNEED, Universal Digital Eye Exam. Universal Newborn Eye Exam Digital. Yeah, I think that's what it is, right? So without further ado, I'd like to call upon, hi Bani, thank you so much for being here. I'd like to call upon Dr. Sunder. Let's see if the doctor's ready to come on. Let's see if he's here. Hi doctor. Hi doctor.
Hi,
Actually,
good afternoon.
good afternoon to you. Actually, okay, I kind of fumbled just now when I was trying to introduce this. Doctor, what I did was I actually promised our viewers that in a while you will be actually showing us how to use this. So would that be okay with you?
The
infant
talking about, yeah, I will do that. That's no problem.
Yes, thank you so much. Okay.
No
okay.
problem. I'll do it.
Thank you so much. Okay.
Right.
So doctor, I think this lot has a lot of questions to ask you.
Sure.
Yes, I'm sure there's a lot of parents, new parents and parents to be here in our audience. So maybe I would start the ball rolling and ask you one of the questions by myself, okay?
Sure.
So maybe we can start off with this. So what are the possible causes of eyesight issues in babies, including newborns, doctor?
Okay, so when you talk about eyesight issues in babies, we're just not talking about the eye alone. Yeah, you have problems at the level of the eye, but don't forget, vision includes the optic nerve and also the visual cortex in the brain. So when we have eyesight issues, you have to consider all these components. Let's talk about the eye now. When we have the eye, some of the more common problems are like retinal hemorrhages. Now you can get bleeding in the retina in newborns. And why is this so? When babies are in the process of birth, there's a lot of pressure on their head, and this pressure, either through the birth canal or even through the cesarean section or forceps delivery, can compress on the head and also on the eye, and it can cause bleeding. And we know now, we have more and more data that suggests that but maybe 5 to 10% of these babies who are born have some amount of retinal hemorrhages. Some of them may be significant, and if it's bled in the center of the retina, in the macula, that's going to cause visual impairment and scarring. So that's one. We also do get babies who are born with malformations in the eye. One common one is called the retinal coloboma. You can see here on the screen, these are the retina of babies where it's not formed properly, and this can cause severe visual impairment. And this happens at birth. We also have conditions like congenital cataracts. Cataracts are not exclusively found in adults. You can also find it in children, in newborns, for many reasons. And it can be even genetic causes, or if there's some metabolic disorder in the child, they can have this. So this can be missed if it's not properly screened at birth. Now, what are the other things that we can see? Now, we also get babies who are born more and more premature now, and these are babies that are at risk
True.
For getting immature retinas, and if they are unlucky, these retinas can scar, they can bleed, and the retinas can detach, and these babies can lose vision. So these are some of the conditions. And of course, from time to time,
any of these reversible, doctor?
Yes.
Are any of these reversible?
Yes, of course. The hemorrhages are reversible. The cataracts are reversible. They're amenable to surgeries. The retinopathies in premature babies are amenable to laser therapies and special injections in the eyes. And the most scary one is, if this is retinopathy of prematurity. You can see the retina is not fully developed and it's bleeding and scarring forming here. And the most scary one is if there's a tumor in the eye and you have it in newborns sometimes, and this is called retinoblastoma. This can be treated if it's picked up early. We can do chemotherapy, we can do radiotherapy for this baby.
Chemotherapy?
Yes, yes, we can. Specialized therapy, and if they come late, then we have to remove the eye. Or if it's worse, they may spread and it can be life-threatening. So these are the level of the eye. So we also have babies sometimes when they're born, they have inadequate blood supply. They are ischemic at birth. Many reasons. That, or even with seizures or infections at birth, these can cause damage to the brain, especially the visual cortex, and this can lead to sometimes significant visual impairment or even blindness. So these are things, the eyesight issues that you probably come face to with. These are some of them. There are many more. The more common ones in babies or newborns. Right.
Okay.
Yeah.
Thank you so much, doctor. Hey guys, thank you so much for being here. Thank you for everyone who is coming in right now. Thank you so much for being here. Hi everyone. Hi Ariel. Hi Annie. Hi Cassandra. Hello. Thank you for being here. All right, guys. If you guys would do me a favor and show the doctor some love, that would be so great. Just put a little love. Or what's that thing you guys do nowadays? This. Okay. We're going to do that. We're going to do lots of that in the comment. Okay. So all this counts as being active participants in our Facebook session, so that you can win yourself one of these. All right. All right. Please. All right. Thank you so much. Okay. So doctor, can I move on to the next question? Because we have quite a few here. And guys, don't forget, if you guys have a question for a doctor, please don't forget to post it right there. Okay, and we'll choose some for the doctors to answer. Okay. So okay, doctor. So what are some of the vision problems in babies that may get missed out during the initial checkup when they were just born? Okay. So what are some of the vision problems that may get missed out?
Yeah, sure, Cindy. What I'd like to talk about are some of the vision symptoms that may indicate poor vision. Then I'll also talk and explain why they get missed out. Now, some of the symptoms or signs that the babies may have that may actually indicate poor vision are things like, a shaky eye, and we call that nystagmus. The eyes, they shake for a while or they shake constantly. So that's one. That means the child is not seeing well, especially after ages of 3 months. Now, the second one is the baby is not seeing well, sorry. The other one is a constant searching eye movement, as if the child is trying to see, but the child can't see. He's trying to look for something. The eye is always searching. So that's a sign. This may indicate a problem at the brain, at the visual cortex. The third is misalignment of the eyes, squinting. It can be a horizontal misalignment or vertical misalignment. So these indicate the baby may not be seeing well, right? Mostly, especially if it's after 3 months of age. Now, the other is delayed milestones. And we know that, when I talk about vision is the most important component of development. So if your vision is poor, your milestones are going to be delayed. You're going to start sitting on later. You're going to start reaching out to objects later. So these are some of the signs. Now, the last one I'd like to talk about is a white reflex in the pupil. If you see something white in the pupil, that's no good. That could be a cataract, or that could be that means a lens opacification, or that could be possibly a tumor in the eye. So if you see something white in the pupil, please don't wait. Get that checked immediately. Now, when I talk about, coming to the next question which you put to me, Cindy, why are these problems sometimes missed? When
so undetected.
You imagine you've got a newborn baby at the antenatal, or a baby just come after a couple of days to their examiner for check. Sometimes they're crying, when they're so small, they're crying, they're hungry, they squeeze their eyes. It's difficult to open the eyes. And in that process, you may actually miss out. You may invert the eyelids may flip over, so you may not be able to look at the eye properly, and you may miss. The other is the baby may be asleep. In deep sleep, the eye may be uprolled. So when you open, you don't see the black of the eye, you just see the white of the eye, so you may miss something. And of course, you're not going to look into the eye to pick up things which may be behind the pupil or the lens. So you may miss those things. And of course, babies these newborns are so small, their eyes are so small. If the examiner is not experienced, you're going to miss out. If they're not thorough, they're going to miss out. So these are reasons why sometimes a physical examination may not be enough. They may miss out, right? Yeah. I hope that answers the question. Yeah.
That does. It certainly does. Thank you so much, Doctor.
Yeah.
Hi, Sapna. Hi. Thank you so much for being here. Okay. So guys, don't forget about our giveaway. Okay. Don't forget about our giveaway. Here, I'm going to show it to you again and again and again. Okay. Because this is like a very special set of cards here, and the doctor will show you in a bit exactly how you can use this, because it only counts if you use it properly, right? So okay, so doctor, wait, before we go on, may I just take just 1 second to remind our audience that this giveaway is one. We also have something else for you, and that is a very special promotion only for today during this Facebook live session. Okay, so Babyside is giving away, not giving away actually. What I mean to say is, if you're a parent or a new parent and you want to have your baby's eyesight tested, so what you can do is you can WhatsApp the number. The number is we'll give you the number here, and WhatsApp and tell them that you want to have an eye screening for your baby or newborn. And what you can do is you can actually do it today while this Facebook live is going on. And if you do that, what we can do, what they will do is they'll give you a very special price, okay, of 400 ringgit, and the normal price is 495. So if you do it today, if you sign up today, and you get it for just 400 ringgit. And not only that, if you do it today, that right now during this Facebook live session, they will also give you this as a free gift. Okay. Thanks so much. Thank you so much, Doctor. So can I carry on with the fourth question? We have one here.
Sure.
Okay,
Yeah.
what should parents do? What should parents do if they suspect that their baby may be facing a vision issue?
2 letters. Don't delay. Now, if you suspect, don't delay. Go. If you have an ophthalmologist nearby, please go and see him. If you have a pediatric ophthalmologist around, even better, go and see the person. Now, we sometimes may not pick up these problems in the clinic when the baby is there for, the reasons I mentioned earlier, sleeping or, they're crying. So if you see a sign or if you see a symptom that's worrying you, and if nowadays all of us carry smartphones, take a video, take a picture, and bring that along, because that will really help. So the thing is, if you detect something, and if you think it's something that's repetitive, take a video or a picture, bring that along, don't delay, get your baby to a doctor. If you don't have a ophthalmologist or a pediatric ophthalmologist, get them to a GP, or even an optometrist, because optometrists are also trained to detect problems. So you can do that too. Yeah.
I see.
Yeah.
Okay. Okay. Thank you so much, Doc.
Yeah.
Okay. Please share with us the impact of the benefits of UNIT. Just know I did mention UNIT, right? UNIT. There's a universal newborn.
Yeah, it's a tongue twister, isn't it? Yeah. Even I have trouble sometimes. Now it's called Universal Newborn Eye Examination Digital, or UNIT. Now it's been around for some time internationally, but it's just come to our shores over the last 2-3 years. And Babyside has been the first and currently the only providers of this service. And here what we do is we use a very special digital camera, a retinal camera. We call it the RETCam. And can I just get that on, and I'll just show you. And we can use this camera now to actually help take very clear pictures of the eye. So this, I'm just going to use a mouse scroll, and this is the camera. It's a very expensive specialized camera. It's got a handpiece, and this handpiece was actually designed by 2 Nobel Prize winners. And this handpiece actually will go on to the baby's eye. I'm going to press on that slide. And it's very gentle. It's been made not to cause any harm to the eye. Now, the people who do this are trained professionals. Yeah, it's scary, but it's trained professional nurses and technicians who do this all the time. So the pupil of the baby will be dilated. They will put a eye speculum, which is not going to cause any harm to the eye. It's just going to open the eye after putting some anesthesia on the eye. And once the eye is open with the speculum, we have a good view of the eye. We'll have a look at the front of the eye. We put the camera on the eye. It'll take a nice picture of the back of the eye and let us know. So if you notice, these previous pictures that I've taken and shown you all, they're all taken by this camera. Now, I'm going to go back. I'm going to show you the pictures now. These pictures of retinoblastoma, these pictures of our retinopathy of prematurity, these pictures of the cataract, coloboma, all these have been taken by this camera. You're not going to get a clearer picture than this. So if you've got some pathology in the eye, it's going to pick it up, right? So this is basically the examination. The examination is it doesn't take too long, between 5 to 10 minutes at most. Of course, the baby may not be happy, they'll be crying, but we wrap the babies up. So far, we've been doing it for the last 2 to 3 years, and we've been having no problems with it.
2 to 3 years, okay.
So that's basically UNID. And UNID now, I think worldwide, countries like China is full-fledged, the UK, the US, it's been going on. And I think there are millions of babies that have already been screened. It's a little bit slow in Malaysia, but I think we will slowly pick up here too. Right.
Thank you so much, Doctor. Hi, Nina. Ashley, thank you for being here. Hey, guys. I need you all to do me a favor. Okay, please like this post and share it so that many others out there will know what we're doing here today. Okay, that'll be really great. And also, please don't forget, if you want to be in running for this infant vision stimulation flashcards, please don't forget to like the Baby Side Facebook page and then come back here and tag 3 friends in this post. Okay, please do that. And that's not all. Please also feel free to comment as much as you want. Okay, whatever you want to do, you want to give the doctor a love, you want to give me a love, you want to do 100 thumbs up, it is good. Just do whatever you want. And please ask the doctor anything you like. He's here for you to ask questions about newborn vision development. Okay, and also about anything you want to know about newborn eye screening, he is here, right here. So you can ask him right now, whatever it is you'd like to know. Thank you so much. So, okay. So, Doc, can we?
Hello, Cindy. Yeah, I'm here.
Sorry. Yeah. Technical issues here.
Yeah, I know.
Okay. So, do you think should we continue with the 6th question?
Sure. I'm fine. Please do.
Okay. Wait, hold on. Oh, okay. All right. Yes. So, Doctor, it appears that we have a question by one of our viewers. Okay, I'm so sorry for that. Okay, I picked on it too late. I'm so sorry. Sorry, guys. Sorry for that. Sorry, Vincent. So I really did not see your question. Okay. So thank you for that. So Vincent So has this to ask you. Okay, Doc. How frequent do you need to carry out eye screening for premature baby? That's a really good question, Vincent. Thank you.
That's a fantastic question. Now, we normally, when we do screening for premature babies, we normally screen at-risk babies. So those who are at risk normally are 8 weeks or more premature. That means 34 weeks or more premature. That means 33, 32. Or if their weight is 1.5 kgs or lesser, that means 1,500 grams or lesser. So if you fall in that category, your baby's vision will be screened. Of course, some pediatricians may say, okay, so the baby may be heavier, the baby may be slightly older, we still want to screen the baby just to make sure we don't miss out anything. So once we start screening, say if the baby is born at 34 weeks rather than 40 weeks, we start screening at 34 weeks, we can start screening about 2 to 3 weeks after that, maybe around 37 weeks. And then do every 2 weeks till maybe 41, 42 weeks. Now, if the baby has got no signs of any retinopathy or prematurity, then we can stop with frequent screening, and then we can probably see the baby at 6 months and then 1 year. Because these babies, though they may not develop retinopathy or prematurity, may be more at risk for developing degrees in their eyes later on, or conditions like squinting. Yeah, so that's why the examination is gone, and after that it can be a yearly examination. Now, if the baby during that premature period has a retinopathy or prematurity detected, then the screening goes weekly until the retinopathy disappears or if treatment is required. So that would basically cover your screening in a nutshell.
Yeah. Okay, thank you. I hope that answers your question, Vincent. So thank you so much for that. All right. So okay, if none of you have any more questions, okay. So why don't I carry on with one of my own now? Okay. So how can 𝗏𝗏𝘃, this is where you are affiliated with, right? So how can 𝗏𝗏𝘃 make a difference for parents whose babies are having vision problems?
Okay, so 𝗏𝗏𝘃 basically does a screening service. Now, if that's all, we do offer the services sometimes with certain doctors who need the camera service. If they already have a pathology, they just want to confirm. Now, once 𝗏𝗏𝘃, the red cam machine through unit has detected some malformation in their eye, some vision threatening condition, this would allow a few things. If the condition is amenable to therapy, then we can actually get some form of medical or surgical therapy in early, and that would allow the child to have a better visual prognosis. Now, if it's not possible, then we will be able to educate the parents better with pictures, and also this would allow parents, we can allow parents maybe to go for some genetic counseling because they're worried, my first baby had this problem, will my second baby have the same problem? So this will be something that would help in that way. Now, the third thing I can think of is, now if you have a condition that is picked up early, and it's something that is not really very amenable to therapy, but something that we could probably help in other ways, like low vision aids, then we can probably start that early, do vision, what do you call it, early intervention, to help them optimize whatever low vision they have. So these are ways that actually unit can help. Yeah.
Okay. Thank you so much. Thank you so much. Okay. So hey guys, don't forget. We have this up for grabs. Okay. So all you gotta do is go and like the 𝗏𝗏𝘃 page. This is the 𝗏𝗏𝘃 page right here. Sorry, 𝗏𝗏𝘃 Facebook page. Go and like their page. Come back here, tag 3 friends, and as I said, that is the really easy part. Okay. If you really want to get your hands on this here, please be an active participant in our Facebook Live right now, in this session right now. So first of all of you here who are here, if you learn something from doctor today, why don't you all give him a thumbs up, or one of these little things, love or whatever it is. Do that now. Okay, this is really mean a lot to us, and of course it counts as being active to win one of these. Okay, so don't forget also today, just for you guys, just for parents and parents to be, someone saying hi, Dr. Sunder. Must be one of your fans. So parents and parents to be, I'd like you to take note that today, if you sign up during this, during our Facebook Live session, if you sign up with 𝗏𝗏𝘃, all you gotta do is WhatsApp the number that's given somewhere in the comment there, pin in the comment. WhatsApp them and tell them you want to sign up. You will get it for a very special promotional price. Okay, for 400 ringgit, and normally it is 495, but just for today and just for this 1 hour, you'll get it for 400 ringgit, right? And also, not only that, they are also throwing in one of these for you if you sign up today. Okay, so please do that. All right, and please don't forget to share these posts. Please, people, don't just keep all this information to yourself. Please share this far and wide so everybody will know exactly what is it that we are doing here today. Right, doctor?
Yes.
So, okay, and if you have not yet liked our Facebook page, Baby Talk, please do so. please follow us, okay, for more of this kind of live videos in the future. So okay, actually, doctor, there is one more question from one of our viewers. Yeah, I really hope that you can take this. Okay, so she wants to know, Jenny Tay wants to know, is this suitable for a 6-month-old? Oh, maybe what she means is it suitable for a 6-month-old baby to be watching TV? So Miss Jenny, Jenny Tay wants to know if a 6-month-old baby should be watching TV. What do you think, doctor?
It's interesting because now a 6-month-old baby may not watch TV because a 6-month-old baby's attention span will be so short, they may not be able to watch TV. They may get excited at seeing the mother, they may get excited at seeing a toy and taking, but if you put a screen in front of a 6-month-old, of course, they may look at it, oh, what's that, for a short bit, maybe, 30 seconds or what, and then after that, they're not going to watch. Actually, if you look at children, until they're about 3 or 4, they can't really sit very long in front of TV screens. But now that's not the same with handphones and games, and with YouTube. But in the old days, a classic TV screen, they can't sit and they can do 15, 20 minutes. It's only after they're 4 or 5 they can actually sit through a complete feature movie. So if you're talking about a 6-month-old baby, you can put the baby in front of the screen. I doubt the baby is going to be watching it anyhow. It's going to just look elsewhere after about 30 seconds to a minute. So I don't think it's not suitable, and it's not going to be possible also.
Okay. I think I saw a question from 𝗓𝙧𝙀𝘃𝗯𝐿 just now. Okay, I'm not sure where it went. Okay, so in the meantime, guys, okay, please remember. Okay, there it is. Okay, now we have one here from yes, exactly. Okay. 𝗓𝙧𝙀𝘃𝗯𝐿 would like to know, do premature babies have risk of having eyesight problems?
Good question. Definitely. Now, the more premature baby, the more problems the baby may face. Now,
what do you mean by the more premature, doctor?
So we have premature and have extreme prematures. Now, the premature babies that are at risk are those, as I mentioned earlier, 34 weeks or 8 weeks premature and 1.5 kg or lesser. So they are at risk for developing something called retinopathy of prematurity, where the retina can scar, it can bleed, and the retina can detach. Now, as the baby becomes more premature, especially if they're less than 30 weeks and less than 1,000 kg, 1,000 grams or both, then this risk becomes more, because they also have other problems. They have breathing problems, they'll have not enough blood, they'll have anemia, they'll have sometimes infections. So all these things can cause this retinopathy of prematurity to become more aggressive. So this is the first and significant problem that we are facing with premature babies. Now, if the baby is premature but more than 34 weeks, 35 weeks, so the weight is more than 1.5 kg, then the risk is much lower, much lower. But again, these babies, when you compare premature babies with normal babies, they are at higher risk for getting degrees when they're older. That means they get more chance of getting astigmatism, more chance of getting myopia, short-sightedness, or getting long-sightedness, or they can even develop squints. So these risks are more in premature babies. So these are all visual-related problems that would be at more, which premature baby would be more at risk. Yeah.
Okay.
Yeah.
Thank you so much, doctor. So I just want to pose a small question to you. Huh? Okay. Yeah. Okay. So Amalina has something to ask.
Sure.
And okay. So actually she has a daughter with lazy eyes since the baby was newborn. And she realized when she was 1 year, 6 months, and she's still doing follow-up with the doctor, and she's wearing specs. So she's wearing glasses. So she wants to know when exactly was the best age for a baby or kids to go for eye checkup. Probably what she means is in her case, because maybe they found it a bit too late.
Yeah, you see, that's where baby side comes in with this unit, because unit is done at birth. So if there was some significant problems in the structure of the baby's eye or something that we detected, then we, it could be addressed earlier. So ideally, we should have all newborns having their eyes screened and checked thoroughly and properly. So that's the first thing. So now that would be what I would suggest. Now, of course, sometimes it would be good to check after. If you miss that, then maybe at age 1 to 2, you can actually have a check with a pediatrician, or at least an ophthalmologist or a pediatric ophthalmologist. All children between the ages of 4 to 6 should have their eyes screened. We did the Ministry of Health in 2016 did the 𝗏𝗃𝘃𝑠 eye survey with the Monash University in 𝗏𝗏𝘃 district. We found that more than 13% of our children 4 to 6 years of age had some sort of visual problem.
How many percent was that again?
More than 13%, 13 to 14%. That's significant. That's significant, And yeah, so that would probably answer that question from your viewer. Yeah.
It actually certainly does. What about all those kids that watch a lot of YouTube? Because nowadays babies, the parents have the habit of giving them handphone
handphone and YouTube have become very, very good babysitters, but it's not very good for the baby's social development. They become addicted to these devices. They hang on to it. They don't want to release it. They cry. They throw tantrums. It's become so much so. It's become a social. It's an issue with children's more than the child's development. Of course, white light, going into a child's eye will cause a lot of eye strain. They can go half an hour, 1 hour, 2 hours without stopping. I'm talking about the older ones, those are between 3 and 6. Yeah, so it's not good. We shouldn't use it to babysit. Not the phones. I'm totally not for handphones in young children, in toddlers and preschoolers.
Okay, thank you so much, Doctor. I actually see a very good question from Vincent Saw here, and I will get to it really soon. So, okay, let me hold on, just 1 second. Just 1 second. Okay. Okay. Hey guys, we really want to give this to you. Okay, we can't wait to give this to you. We have a limited number of these to give away. So please like the Baby Side Facebook page if you haven't yet. So please do that for us. Thank you so much. And also, please tag 3 friends at least in the comment space. Thank you so much for doing that. And also, that's not how you win it. Actually, how you win it is, as much as we would like to give it to you just like that, we'd like to see you do more on this Facebook live session. That means you got to comment, you got to engage with us, you got to show us that you are there. We have to take notice that you are there with us. Okay, so thank you so much. And okay, I would like to remind viewers today that apart from the giveaway we have today, we also have a very special promotion. So all those of you who have babies, newborns, and those of you who knows, or anybody who have babies or parents to be, okay, please, if you sign up today during this Facebook live session, we are going to give what Babyside is going to do for you is they're going to give it to you at a very special promotional price of 400 ringgit. Okay, the normal price is 495. So there's a lot of savings if you ask me. And not only that, they are also going to throw in this for you as a free gift. I'm always having problem trying to get this right. Yeah, there you go. Okay, infant vision stimulation flashcards. Okay, from Babyside. So please like the Facebook page and give us all the love. Thank you. Hi, Joshua. Thank you for being here. Thank you for being here. Thanks, S. Lim Yo. Thank you so much, Emily. So we actually have more questions for you, Doctor. Are you up for it?
Sure. I'm fine. Shoot.
Okay. Yeah. Shoot. Okay, I will shoot.
Okay.
So we can see there's a high prevalence of vision issues among the very, very young today, right? So why is that? I mean, apart from the YouTube and the and all that, why is that? Is there something else that we don't realize?
Okay, it's interesting. A very good question. You look at families now, they are much smaller, compared to families, my parents' families, and my grandparents' families. So families are smaller. Parents are better educated these days. Most of them are university educated. There's increased awareness, with so much education going on. So when babies are born, if they're suspecting something, they go immediately. Most of the time now, these parents they tend to take the trouble to go and get these problems checked. So together with advancements in medical technology and with medical science, improved examination techniques, we detect more and more problems. It's not to say it was not there earlier, but we're detecting more problems earlier now as compared to, say, 20 years ago, 30, 40 years ago. And our population is also larger now, I guess. And, because of that, there's increased prevalence. We see these things more, Right. I remember the old days, I go and tell my dad, look, I'm not seeing, don't disturb me. I know I'm busy, I'm working. But now parents say, okay, fine, let's go to, doctor, let's get it checked. So things are a little bit different these days. Parents are more concerned, I would say. Not to say parents do this or not, but they tend to, there are other things to tend to more often. Right. So I think that's why you see a larger prevalence now.
Okay.
Yeah.
Thank you so much, doctor. I think we have a question from. Okay, no problem. So, okay, what are ramifications of neglecting professional eye care for babies these days?
Oh, okay, this one is good because
I think a lot of parents actually neglect, or maybe they don't know.
I see. Yeah, going back to the previous question, in the old days, parents used to be more relaxed. They got, their main aim was, earning for the family, getting a meal. Big families, family with 7 kids, 8 kids. So children will have eye problems. They go missed, and what happens is, now if a child and eventually I meet adults these days, or 30, 40. Look, doctor, I have lazy eyes in my right eye. Nothing was done as a kid, but no, my vision is bad in the eye. So that is a ramification. Now, if a child has got a visual problem as a baby or a newborn, and if it's not addressed now, if this problem is at the level of the eye or at the level of the visual cortex, now if it's not addressed early, what happens is the quality of vision that the eye is perceiving or the brain is perceiving is not good enough. What is going to happen is that whole visual system is not going to be efficient, and the visual system is not going to be mature enough. And what is going to happen is that poor quality of vision in the eye is going to become permanent as the child grows older and older. It's not going to be reversible, and that's what I call amblyopia or lazy eye. So when you have poor vision at the level of the brain due to poor quality of image or stimulus, either at the level of the eye or the level of the brain, and if this is not addressed, there are ways. We address the primary cause, we help the child's vision improve. Now, it's not addressed, that laziness in the brain, that amblyopia, will become more and more difficult to correct as the child grows older. We know as a norm, when the child is around 7, 8, 9, if the child has had amblyopia from birth or a very young age, it's going to be much more difficult to correct as compared to when the child was caught at that point of time, age 2 or 3, and corrected.
Okay. Thank you so much, doctor.
Yeah, I hope I've given a clear message. So what the ramification is, if you miss out on a pathology in the eye, say if you've got a cataract or if you've got a high degree in the eye and if it's not corrected, what will happen? That would result in poor quality of image going to the brain. The brain doesn't process very well. The brain remains immature. Quality of vision at the brain becomes poor. And so if the correction is done late, say if it's a cataract at 2 and it's missed out and it's corrected at the age of 8, the laziness in the brain will not correct it. So though you have taken out the cataract, put a good lens in the eye, given glasses, the laziness in the brain, the amblyopia, will be more difficult to correct. The brain doesn't want to learn.
Is that why we call it lazy eyes?
Yeah, it's actually a misnomer. You can't call it lazy brain, so they chose lazy eye. But the better word is amblyopia. Amblyopia.
Yeah. All right.
Right.
Thank you. Thank you so much, Doc.
Don't delay.
Okay.
Yeah.
So I wonder if we have any more questions from our viewers here. So wait, hold on. Okay. So Doctor, for the benefits of all our listeners, all our viewers, okay,
Yeah.
and I'm sure many of them are either new parents or they are going to be parents. So apart from examination and tests, what other actions can parents take to ensure the proper development of their newborn and baby's eyesight?
Okay, right. Okay, Joanna, I mean, what's this, Cindy, you've been showing the flashcards, right? So,
I have. I really
you've been showing it enough.
the whole
These,
session.
yeah, so this, we have, I think, oh yeah, I have it here. So yeah, now flashcards, these, now I'm showing it, these flashcards, it helped us, yeah, but there are many different ones in the market anyhow. Now, these flashcards are very useful in helping stimulate a baby, a newborn, or a baby under 6 months visual development. So if can I get the screen on again? So if I were to show you now, I'm going to show you what a baby sees. You know, it's interesting. You're going to get shocked.
Yeah.
Okay, so you're going to go down to this slide here. Okay, right. Right. So now this is what a newborn baby sees. It's everything is blur and everything is black and white, and by 1 month they're going to see the a little bit of their mother. Can you see the screen?
No, we can't yet.
Okay, right. Wait. Let me get the screen on then. Okay, let me. All right. Sorry about that. Let's see. Yeah. Let me just put that back on. Yeah. Sorry, technical glitch.
It's still not on, doctor.
How about now? Is it on now?
Not yet. Okay, I think I see it.
Okay.
Wait, hold on.
It's not on yet. Let's try that again. Technical glitch. Yeah. Right now. Okay. Let's. While they're trying to sort that out, can you see that now?
Can we see it?
Can you see it now? It's not there yet. Never mind.
Okay.
Never mind. So we will try and sort the technical glitch out. Anyhow, so a baby.
What are we looking at here, doctor?
Yeah. Can you see that now? Is it there?
Yes.
You can see it now? Yeah, wonderful. Now, right. So back to the images. So this is what a baby sees when the baby is just born.
Wow.
It's just blur. Yeah, because you see the retina is still developing, and the retina develops, within the first 6 months, majority of the retina develops. Then the remainder 10-20% development goes on for another up to 2 years to 3 years of age. So now, so when the child is born, that's what the child is going to see. The newborn baby is going to see. And by 1 month, they see the mother's face a little bit. And by about 3 months, a little bit of color is coming in. You get a little bit of red. And by the time you're 6 months, most of the colors coming. So it's not only color. In that 3 to 6 months, they start developing contrast. The area of vision becomes larger, and they also learn depth perception. So now this first 6 months are very important. Now, this vision stimulation cards have been developed to actually enhance. It's just an additional armamentarium to help the baby to enhance the vision. Now, Baby Side has developed these cards. So I'm going to show these cards on the screen now. We've got about. Now, this is the front of the card, that pack of cards. There are about 24 cards with one introductory additional card. And the card has got 4 groups of cards in it. Each group has 6 cards. And it starts with the basic shape first. Okay, this is a basic one. Then you have the combination of shapes. And these 2 shapes are in black and white, right?
Why is that?
Then it's in black and white. The first is a basic shape in black and white. I'm going to show you those cards later. Then you have the combination cards, which give you more detailed shapes, but also black and white. Then the third group of cards, you bring in the colors in slowly. You get red in. And the last group, the group 4, are more complex shapes with most of the colors in. So what we do is, now I'm going to, this card, this explanatory card, on the back of it, teaches us and tells us how to do this stimulation. Can you see that now? Sorry, I'm okay. Can you see that now? Yeah, sorry about
Yeah,
that. I just yeah.
I can see.
So now, yeah, I'm on the screen, so I can see myself. So this back of this card, this is the original front of the card with the 4 subgroups. Yeah. Now, each subgroup has got 6 cards, back and front. I'm going to show you those cards. And as I said, those subgroups include the first one, basic shapes. The second one, combination of shapes, both in black and white. The third is where we introduce colors. We start with red because babies start to see red color first. And the last group has more complex colors and more complex pictures. Now, on the back of the card are instructions on how to use it. Now, if you've got a baby, we normally start this. You can start this between 2 weeks to 1 month of life. I think before that's a little bit difficult. You store the cards when the baby's eyes are open, not when they're asleep. Okay. So,
That makes sense.
about 1 month, I think 1 month is reasonable. You know, you start and you keep it. You keep it when it's about 1 to 2 months. You keep it about a foot away, or slightly less than a foot away from the baby's face and eye. You hold the card. So now this is the one you probably start with. This is the basic one. Now it's black over a white background. But you flip it, you've got white over black. So you can show this for a couple of seconds. 5 seconds, 10 seconds. Yeah, you show face up. Hold it. It's stimulating the eye. Then you can switch it. You show it. Then you can drop it. You can pick up the next one. Yeah, you can flip it. So you've got this, and you can do this as often as you want when the baby is awake. Now, babies at this period of time sleep most of the time anyway. So when they're cooing for a while, they seem to be happy, you can show it to them. So these are the basic.
For them, doctor?
It stimulates. See, initially, babies don't have color, you know, the first 3 months. So it's going to start stimulating the contrast, black and white. Remember the picture, the first 2 pictures, it's hazy black and it's black and white, it's hazy. Now, this is going to start stimulating contrast, black and white first, right? So that's how we do it. That's why we don't go into color yet. Now, going back to the next group. So once you're about 3 months, you've already done these simple ones, and then you've maybe in the second month you've gone off to the complex pictures. Let me see. Now these are the more complex black and white. So black and white again, front and back. Month 2 you've done this, you know, and you're getting bored. Maybe the baby is getting bored. So by the time you go to month 3, so you've got all this. There's so many actually. Now you can't, if you can't finish all of them at one go, you can show maybe 1 or 2. You know, you play around with how long the child is interested. So by the time you go to month 3, 4, you can start showing this. And now look, the flip side, you've got, you know, the same pattern, but with a different background. We just changed the background. So this is interesting. This starts to stimulate the red color cells in the retina, you know, the red cones in the retina. And we can do this. And eventually by month 5 and 6, you can actually go to those more complex pictures. Now, you can do this.
Oh, that's really nice.
Yeah. These cards are actually good quality laminated cards, good quality plastic. So, and if the baby decides to glue on it, you can actually wipe it off. So if there's a bit of, you know, food falling on it, you can wipe it off. It's quite solid, so it's pretty okay. Now, so you can do this till about 6 months, and you actually can go on till the child is 1 year. But you know, with most babies, by the time they're 8, 9 months, you know, they get bored. So if you can do that by, you know, up to 6, it's fine. You want to go up to a year, it's fine. But you know, in reality, you know, after 6 months, they find other things, toys, rattlers, this and that more interesting. So these are useful actually for the very first 6 months. 6 to 12 months, it's up to you, right? So this is, I've put it all over my table. So these are the vision stimulation cards that you can actually use. Simple things that may really help, right?
Fantastic.
I hope that was clear enough.
Yeah, that was great, doctor. You actually showed our viewers how to use those cards, because I've been flashing it in front of their eyes throughout the session.
You think showing something like this to a 1-month-old baby is not doing anything, are they saying? But it's actually stimulating the eyes.
Yes,
you don't realize it. It is. Yeah.
Exactly. So hey, you guys, are you still there? I see most of you all are here, still here, glued to what Dr. Sunder is saying. So if you guys want to win this, okay, it's still not too late. Please like 𝗏𝘃𝘀𝗶𝐵𝑐𝑠𝑖𝑑E Facebook page, okay, and tag 3 friends to this post here, and also please, okay. Still one question.
Sure. I think
I think we have one more question. Okay, so please comment as much as you want in the comment post. Please do that now. Okay. Right. Esther has a question. Okay. Baby eye problem. Okay, I think what she means to ask is a baby's eye problems caused by DNA? Do they need to check their family history?
Yeah, there are some conditions, eye conditions, which are vision threatening in babies. Now, I didn't mention all the conditions because there are many conditions actually. There's some of these conditions that are due to genetics, and if a child has got it, it's always good to check the other children and also check the parents, because sometimes though the genes are there in the parents, it may not be as severe. Now, there is one condition, like I'll just take, it's called familial exudative vitreoretinopathy, very long-term FEVR. It can run in families. I have an entire family where all the males have this problem. And you know, in anticipation, I remember one of my patients, he was actually an adult, his wife delivered a boy, and behold, the boy had the same problem. But you know what? We anticipated. We started the treatment early, and he's doing a lot better than his father and his grandfather. But probably they are actually legally blind from this condition. So yes, there are some of these conditions which are genetically predisposed. Retinoblastoma, which I spoke about earlier, can sometimes run in families. Not always, but sometimes, yeah. So there are certain conditions that are genetically predisposed where if it's there, you need to check the rest of the siblings. Yeah.
So yeah. I hope that answers your question, Esther. I'm sure it did. So
DNA, yeah. DNA.
Yes.
Yeah.
So, Dr. Sunder, I would like to thank you so much for being with us today. It has been wonderful having you on board with us. And looks like we're coming to the end of our session. So I would like to once again thank you so much for being with us. I'm sure our viewers benefited from everything that you have said. Okay.
Thank you very much.
Okay, once again, thank you so much, and we'll see you next time. Thank you.
And keep safe, everyone.
Yes.
Take care.
Hi, guys. Okay, so it looks like we have come to the end of our session. Thank you so much for being with us. We are Baby Talk, and today's session was brought to you by 𝗏𝘃𝘀𝗶𝐵𝑐𝑠𝑖𝑑E. Okay, if you haven't liked the Facebook page yet, please do so now. And thank you so much for being with us. And okay, so please don't forget to share and like this video, and so that more parents and parents-to-be will get to know more about infant newborn vision development. Okay, thank you so much. So that's all from us today. So I hope you guys found this session to be informative. So actually, it's not too late for you guys if you want to still sign up. If you want to still sign up for the promotion that 𝗏𝘃𝘀𝗶𝑖𝑑E is having right now, because technically you're still on right now. So what you have to do is just WhatsApp them and tell them you want to sign up for the special promotion, and you get an eye screening, an infant eye screening for as low as 400 ringgit. The normal price is actually 495, and today you get it for 400 ringgit. Okay. So I hope any of you who are interested to do it right now. Okay, don't wait any longer. So that's all from us today. So thank you so much, everyone. Bye bye, and stay safe.